Hello, this is Dr. Sukalyan Purkayastha. I'm a neurointerventionist, and today we'll be talking about spinal arteriovenous malformation. In my last talk, I have dealt with the brain arteriovenous malformation, and today I'll be talking about the same entity happening in the spinal cord. But obviously, this disease of the spinal cord is a dreaded disease, and they can present and affect very young persons. And they can come with sudden loss of power both in hands and feet, and obviously there can be a problem in bladder and bowel, which can happen extremely suddenly, and also maybe having some pain in the back, which can happen because of the bleed which can come out from this AVM, arteriovenous malformation. So without wasting any time, you should go for a spinal imaging, and it should be MRI scan, which is the single most important factor. You should not be wasting your time doing any other investigations. MR, this is an MR of this patient, as in my slide, as you can see here, and it shows the AVM nidus, this dilated venous channels and the arterial channels which is inside the cord, and this is the angiogram. So once we detect it with an MRI scan, the next step is angiogram. This is the angiogram, how it looks like. The anterior spinal artery, that is the artery which supplies the spinal cord, and it is supplying the AVM, and we enter into the nidus with a very tiny microcatheter and block this area with a specialized material called NBCA, N-butyl cyanoacrylate, or glue, and that's how we block the nidus of the spinal arteriovenous malformation. So once you do that, this is the post treatment angiogram. You can see that the whole of the AVM has gone, and the cord MR, spinal cord MRI in the cervical region, you can see that the whole of the AVM has gone, and of course there is some a sort of insult which is remaining in the spinal cord from the previous bleed, but this cord looks definitely better as compared to the pre-treatment stage. So in conclusion, endovascular embolization is one of the best, and probably I would say it is the only best mode of treatment when it comes to the treatment of spinal arteriovenous malformation. It is curative. Sometimes we treat that part of the malformation which is creating problem, and leave aside the areas which is probably we are thinking not creating problems, because this is again a bit it requires more skill, but of course it is less invasive and much safer than open surgical technique when it comes to its spinal arteriovenous malformation. So when the patient comes with those particular symptoms, without wasting time, we should go for MR, DSA, and try to treat it with endovascular means which can be life-saving for the patients. Thank you.